So hello, Dr. Mubin. You are a consultant level plastic surgeon. It's great to meet you, and because I have always wondered about so many questions about fillers and Botox, and finally I have the holy grail of all answers in front of me. Thanks for meeting me.
Hi Sophie, thanks. That's very kind of you to tell me and all that. But well, I'll try and see what I can clarify.
Yes.
So there's lots of doubts. It's quite normal to have all these doubts, especially when you're looking into these treatments. And I will see what I can clarify. Thank you.
Okay, so let's start with my first question.
Okay.
When is it good to get Botox? At what age would you recommend that?
Well, this is, I think, $1 million question, which is very, very common, especially among the youngsters. Because I think since over time, this has become a very relevant question because the average requirement or the timeline when the Botox is being asked for is getting lower and lower.
I can imagine.
My take on this is there's no definite timeline when you need it. And it depends a lot on your lifestyle, your skin, your background. And as a rough guide, if you're beginning to see a wrinkle which is there when you're not making an expression, that's definitely the time.
Like the classic frown line.
The frown line is usually the classic one which starts off with. Now, there is something which is maybe related to this, which I might try to clarify. There's something which is becoming more common as a preventative Botox.
That would have been my other question.
All right. Okay.
I mean, I personally started quite young to prevent those kind of frown lines because I've read it in an article that if you already see the frown line, it's basically too late.
Yes. In some sense, that's true actually, because once you've got an established wrinkle, Botox per se might not fix it because your skin has already got changes into it, which has made these lines more or less permanent. And that's where the concept of this preventative Botox comes in. And the whole thing is based on the concept that if you're really overexpressive person or you're prone...
That's me.
Or another thing is if you're constantly out in the sun, where you're risking more sun damage, etc., or you're hereditary more prone for wrinkles, then you kind of think in these lines. And again, the timeline for this is something where you start feeling your expressions are becoming more and more like, if you look at your photos over a few years, you start seeing, oh, when I have that expression, that line is becoming a lot more prominent than what it used to be in the past. But it's not there at rest, but it's becoming more prominent. And that's where you start off.
So once you already have that frown line, for example, there's still hope.
There's still hope to get rid of, as long as it's not like a deep line.
Like a deep
when it's
valley.
Absolutely.
Okay.
So you can try and kind of control it and make that expression less by kind of decreasing the activity of the muscle.
All right. Okay, that's good. And can you ever become immune to Botox? Please don't tell me yes.
Theoretically, not.
Okay.
Because the way the Botox works is...
It handicaps the nerves, right?
It handicaps the nerves by blocking certain chemicals being acted upon by the nerves, acetylcholine. Now, this is a temporary effect because the body kind of recovers from that and starts making things again.
And is it true the more you work out and sweat and steam baths and all of that, that will like wear off the Botox more quickly? Is that...
there is no real evidence for that.
Really?
But there is variable take on it. Yeah. That it might kind of help recover your activity because you're trying to promote regeneration overall because of additional activity around those muscles. But there's no real evidence to say, well, if you do this, that particular thing is going to...
Since when have people been using Botox? Since when has it been on the market?
Oh, it's been there for a long time. Yeah, I think things started off in 1970s, not for cosmetic. I think the original Botox was more for use in children or people with strabismus, like people who have squint eyes, and where you try and control the muscles around the eye.
Relax that.
As a result, you're not seeing that much of that condition.
Okay.
And then Allergan slowly started. At that point, it was also noticed that the wrinkles around were less.
Were disappearing.
So putting that together, like most things in medicine, another use of Botox came up. Botox is actually a trade name for for the actual toxin.
Yeah, the actual product.
And then the company has marketed the Botox, and there are other commercial versions.
So this has been on the market for centuries now. Not centuries, decades.
Sorry, for decades. And the usage has been increasing. I think the first license...
So I mean, because I obviously want to see, because over the years you see all of the possible side effects and so on. So, I mean, there's been now roughly 40 years of studies all around that, right?
Yes, there have been lots of usages, but the licensed usage, you'll be surprised, the licensed usages of Botox are very few. For the cosmetic reasons, the licensed uses for glabella, forehead, and crow's feet has been like the side of your eyes.
Yeah, that's another. I mean, I've never personally done it, but not needed it yet. But for example, there it could happen that like if someone who doesn't really know what they're doing, or could it also happen to like professionals such as yourself, that you hit a wrong nerve and then all of a sudden your eye hangs down, like as if you had a stroke? Because I've seen people like this.
Yes, I know that it has happened. And clearly, if you are versed with the anatomy of where you're putting in, it is unlikely to happen. One of the ways sometimes it happens even in trained hands is we advise not to rub around the eyes, to massage the area for a little bit. So
because then you're spreading the product.
And if it gets into the muscles which actually control the eye movement, sometimes you can have double vision, which is a possibility. But the general principle is if you know exactly where you're putting in and you kind of control it, it's unlikely to happen.
Sometimes I had like issues with my eyebrows that like one would hang down and the other one, but thank God for me it wears. Is it also the younger you are, the more quickly your cell production is going, so Botox that doesn't last so long for you?
Yes, that applies because you're having a lot more activity of your own body you've got a lot more receptors as well. So the Botox per se is going to last slightly less, but it's variable between person to person and your background.
Alright. I mean, for me personally, like it does wear off, but I don't mind it that much. It's quite nice feeling having something moving actually instead of being like one solid forehead. But I would say I would do it like twice a year. Is that too little?
It's not about little. I think it all boils down to what you're looking for. Because you want to kind of...
I like the natural look.
Natural looks. And in the natural look, what I usually suggest is you want to do small amounts and then you don't want to kind of wait completely till the whole thing is worn off because then you're going from 0 to 100 and then going back to 0 or something on those lines. You want to kind of do a smallish amount and maintain that. And average time is anything between 3 to 6 months where you start seeing the wearing it off. Slowly wearing it off. And then you kind of maybe top it up with a little bit more so that it doesn't wear off completely.
And because that's my other question would have been, how long does it last? Obviously that varies also from your own age and lifestyle, I guess.
Of course, if you've got, on an average, I would say about 3 to 4 months is the bare minimum that you would see the expression for, the action for. And beyond... So are you able to do like brow lifts, for example? Everyone's talking about Bella Hadid's new head, basically. So with her, I feel like her whole face is so stretched now. I mean, it looks cool, but what has she done exactly to achieve that? Because I feel like she got a brow lift. Do you achieve that with Botox? Yes, you can achieve a reasonable lift of the brows. Of course, depends variably on what is the starting point. Where would you inject exactly if you want to lift the brows? The concept in terms of brow lift it's a very interesting concept. So you're actually trying to make the muscle in the area that you want to make the lift work more by not paralyzing it. So you actually paralyze the muscle or weaken the muscle on either side. You would think the brows sink, exactly. So you weaken the muscle on either side. So in women, classically, the junction between the 2/3 to 1/3 is the highest point. So you try not to inject into that strip of the muscle all along, and you inject on either side of it. So the muscles on either side are weakened, and the brain is sending the signal to lift everything up. So the bit which is not paralyzed overreacts, so it tries to lift up more. So that's why you create that lift effect. And that's an amazing science behind this. I feel like people should really... It's always so dangerous, for example, getting these self-trained nurses into your house then and they start whipping out the needles and start injecting. I mean, that's obviously what a lot of people are doing, but
I would say rather save up some money and go to a professional like yourself.
Well, it's good to be dealt with professionals. The key difference is, one is you know exactly what you're injecting into. I mean, anybody who understands the anatomy better will get you to a better point, because they exactly know what they're actually doing from an anatomical perspective that gives you the real outcome. The other big thing about the thing is, things can go wrong.
Yes.
They can go wrong at any point with anyone. And although this is extremely rare, but then that's the situation where you need someone who understands the whole process, so that they can go walk with you to the point again to make you back to normalcy.
So I think what a person that people are genuinely interested right now, what did she have done, what didn't she have done, is Bella Hadid. I mean, she obviously had something done. How did she achieve those chiseled cheekbones and this super tight jaw? Everything looks so stretched and tight and lifted, and she's so young. So was that just achieved with Botox and fillers?
I wouldn't know exactly what she had done, but you could achieve something on the lines of what she had achieved using a combination of non-surgical treatments or minimally invasive surgical treatments, as they call it. So surely Botox is one of the things. So you could use Botox to help define your jawline better by relaxing your plasma. That helps. But I think from what Bella Hadid has, I don't think it would have been just Botox alone. Probably it would be at least the Botox with a combination of fillers, which will help define the jawline better.
You build
the jawline, but also you augment the cheek so that the fullness and that happy face comes up and becomes more prominent. So
once you put it in here, your whole mouth corners and everything goes up.
So you kind of combine the fullness of the cheeks, which helps to lift up or show a better expression of yours, and also then you relax the neck muscles and you define the actual jawline a tiny bit more better. So a combination would be a better thing.
And with her, that must be a constant construction site to always keep on, refilling these things. As you said, it's not good to wait until it completely wears off. Absolutely. Clearly she can't do that also with her job. I mean, being constantly photographed, you see every slight change.
Absolutely. And unfortunately, the nature of the thing is that you will have to constantly
once you started, there's no way back.
Well, there are things like fat fillers. If you put your own fat, it kind of stays longer
in your face.
It's
like Samantha in Sex and the City. It's about 2001. I remember that.
It is standard technique of putting fat into the face.
Where would you put that? In your cheekbones? Or?
It again varies. You can pretty much combine it into different parts of the face. Almost as you get the same results as the filler. The key difference is the filler is temporary effect. The fat is relatively...
unless you lose a lot of weight, then.
Unless you lose a lot of weight, of course, that goes off. But it's relatively more permanent. But then that is more invasive in the sense like you're at least taking fat from somewhere else. You have to put fat here.
I mean, I'm open to that idea, but but for example, would you be able to replace lip fillers from like Juvederm, for example, is one of the good brands, right? With your own body fat, would that be possible?
You can theoretically use fillers. Use fat as a filler because fat is a filler in principle. However, of course, you're using two sides of the body, taking from somewhere, putting somewhere else, and also you have risks as well because you can't dissolve. Say things go wrong with the filler, you have just classical fillers these are hyaluronic acid based.
Yes,
and you can use an enzyme to dissolve off the hyaluronic acid. But if you were to put fat and then you have to use some other enzyme to dissolve it off, it makes it a lot more complicated.
I see. So that's obviously the most common filler is hyaluronic acid based.
Absolutely.
Yeah.
Which is a part of your own body. Normally, we all have hyaluronic acid within us.
Yes.
And it is part of the skin or collagen construct.
That's why it also wears off after.
That's why it wears off because over time the body metabolizes because it's part of the normal body.
Okay. And another question, I'm just still obsessing about Bella here. Did she have these golden threads? And if so, what exactly happens? Explain me the process and is it safe? Because it looks a bit...
Threads have been there for some time.
Yeah.
And they are almost as an interface between the classic version of a full-blown facelift to being non-surgical in its entirety of just fillers and Botox.
I mean, it's called like the lunch breaks, the facelift or something,
it's
right?
short like a break lift or something of those lines.
I mean, I've seen the procedure, I've seen that, I've Googled it, I'm quite interested in these things. And it looked, I mean, that's nothing I want to do in my lunch break. It looked intense. I mean, you basically get these several threads on these cannulas like through your face and threaded here, and then basically you end up with a grit under your face that then the doctor pulls up. It looks rather cruel and brutal.
It looks cruel, but in the right hands, using the right product, you could get some good results. Because if you think about it, when we do facelift, one of the things that is done in facelifts is also to tighten the skin and the underlying tissues in a certain direction. And if you've got not enough of excess, what you're doing with the threads is the same thing by cheating, by not touching the skin, but you're going under the skin or just in the deeper layers of the skin to tighten it up. However, the downside is obviously you're using something to hold things underneath without actually releasing them freely and moving them across. And you can get ridges or irregularities based on that if you haven't got the right kind of...
So you would see those threads under the skin basically?
Not directly see the threads, but you would see the direction of the pull by the irregularity that is caused by it.
Ooh, okay.
And the other thing is the actual thread, the nature of the material that is used for the thread.
Is it real gold? Or?
Well, it's called gold, but there are varieties of them available.
All right.
And depending on the product, sometimes these are dissolvable, some of them are not, and they don't dissolve at the right time, and they get variably
and they dissolve unevenly, and then you have
Then you can have problems. And also sometimes the body can react to these things and cause some irritation of the skin, depending on how deep or superficial they are. So there are uses to that, but also there are downsides to it, clearly.
So what would you say the risk ratio is with gold, with those kind of threads and the whole threading treatment?
I think the threads, as a general rule, are a little bit more prone for complications.
Yeah, you don't sound like a big fan.
No, I think they have a role. They do have a role to give you some time, especially if you want to kind of achieve some lift. Whilst not trying to go too invasive.
Do you use them personally when you do reconstructive surgery, for example?
In reconstructive surgery, very rarely we use threads as lift, but we use body to other materials, but then that's a very different spectrum. Here you're trying to achieve something on a cosmetic line to avoid any bigger scars with a minimally invasive possible route, and that's where these threads come into picture, because they can be put in with a very tiny, hardly any noticeable scar. And they can be well hidden with your natural
but is it I mean it must be also like Botox and like fillers, like once you start it you have to kind of stick with it until you die. Is that just like in my house world maybe?
Not necessarily. I think it's something as an intermediary. Because for a good long period you can get away with Botox and fillers. And then if you are having more excess skin and you want to improve on the contours.
But what age would that roughly be? I mean, everyone ages differently, but what's the rough...
You're looking at someone slightly more around 40s or even higher. As a minimal age group. Whereas,
so for a facelift, you would recommend to be at least 40 years of age?
Oh, no, facelift. Your traditional facelifts, you're talking generally about 50 or later.
Right, exactly.
But with the threads, you can probably approach slightly earlier because you've got specific issues.
Also, you recommend the threads by like around 40?
I don't recommend around 40. If really somebody is wanting to, I don't think I would consider anything under 40 for someone with threads.
So what a lot of my friends and I guess also followers and viewers would like to know is, why is it so important to come to a place like Santi Spa here and not get, like the great deal 3-for-1 Botox on the high street?
Well, one of the key things is when you come to a place like Santi, either be it myself or my colleagues, we look at you as a person in whole. So you come to me telling, I want to have my Botox in the forehead. I listen to what you're saying, but equally, I would have my advice in terms of how could you get to a better place in terms of how you look, rather than just saying, oh, I want to just put my forehead and do my forehead and that's it.
Yeah.
So I look at you as a holistic person and offer you a holistic regime to say how you can get to that. That would include general care of your skin and also maybe advise on what else you need to address, or it might be just that you need to address.
It's more a bespoke
tailor-made plan for you as a person to achieve what you want to achieve, rather than saying, oh, I want to have Botox in my forehead, that's it.
Yeah, exactly.
And that's one difference. And the other thing, as I mentioned before, is when things go wrong. Things generally go fine and it's all fine. But when things go wrong, this is where you need that additional help and confidence to say, oh, they are there for me all the time.
Yeah.
And especially when things go wrong.
Exactly.
If it's all going good, I'm more than happy, fine. But if something, you end up with even a small bruise, we say like, there you go, this is the number, you call up anytime, we'll look at you. Or you turn up tomorrow without any...
So you're not alone with your problem and have to Google your
you don't
symptoms.
Have to Google. And if you think about it, when things go extremely long, like you had a filler, you've got a massive bruise, and you've got now situations with skin having problems, you're referred to a plastic surgeon.
Yes.
And that's what you're dealing with already. So we are the final remit when things go wrong. And then we can offer you that support and help to get you from that situation to back to where you should be.
Absolutely. I think it's so important for young people who want to try this to be in the right hands, and that's definitely not on the high street. I've seen, for example, a lot of people on a night out. You see so many girls having lumps in their lips from where the filler kind of like builds that bulge, which looks absolutely shocking. What can you do like against that? For example, would that happen? Can that happen if I would get my lips done with you, for example?
Unlikely, less likely.
There's always
a chance. But then the way I work on the principle that you want to enhance the natural beauty rather than making you look artificial. So my general advice is not to put a lot more, it's called pump it up into the lip. So I try to maintain that natural harmony and balance between your upper lip and lower lip and the different subcomponents of the lip to enhance what is natural and to make you look more enhanced and beautiful. So you try and avoid putting a lot of product in one place, which is where it starts off with this lumpiness and things. And the other possibility of lumps is because of blood bleeding into the area, which again can happen, but you take precautions in certain way, the way you inject, the way you kind of decrease the blood supply by adding some ice and etc. with constrict beforehand.
Right.
So you take precautions to prevent a complication, and then you do your technique in such a way that the complications even minimize. And if the unfortunate situation happens, that if it does happen, then we of course take care of you later on.
Okay.
But generally we try to avoid the lumps.
Dissolve that.
You can dissolve the lump. If the lump is because of the product itself, you could use Hylase, which is an enzyme to dissolve the thing.
How long would it take to dissolve the product?
It varies depending on how much you have. It is better to use it early if you realize that it has been in excess. Yeah. And then you may have to use it more than once to help it dissolve and help break it down. But you need to be also cautious that this is also dissolving the natural boundaries in your own lip as well, because Hylase dissolves all the collagen that is. It also dissolves the hyaluronic acid, which is also there inside your normal.
So that's not like a to-go-to thing that you should do every time. Like, oh, maybe I've done it a little bit too much. Let's dissolve it again.
It needs to be used in expert hands. It's not like, oh yeah, I've put in some more. Let me take it off some more. It's not like you've written on a board and
you get rid of all of your own.
No, but also you kind of cause more bruising and more bleeding because you're trying to dissolve. You're getting tissues broken down all around your normal body as well. So it's local. It's very local still, but you need to use it with good control so that you're not using it in excess, surely to cause more damage.
Of course. Okay. Wow. Well, this was super informative. Is there any tip you can give me for the future with Botox and fillers?
Well, I'm sure you know all these things beforehand. One is, I would say, you need to go to someone who are very clear, especially from an anatomical perspective, what they're doing. Yeah. And it's...
How do I know that? I mean, apart from having a super expensive, well-renowned clinic name that I can obviously Google up, is there any other certificates are something that I should be aware of? How do I spot a good...
Usually a good feedback from your colleagues or whoever have been using that place before is
so it's best to know actually people who have gone there themselves.
Absolutely, have experienced it for the first hand would be the best thing, because certificates, papers don't talk in real life.
Yeah, exactly.
And surely all that helps, because
everyone can fake that, not
necessarily fake, but if somebody has got a qualification, surely they are right to do the job.
Yes.
But how long they've been doing, and if somebody had a first-hand experience of them, that surely is a big thing. And also when you have the consultation yourself, you would know just from the talk in terms of what they're addressing, how they're talking about the different subunits, which parts they're going to address, which parts they're not going to address, rather than saying, I'm just going to put things somewhere there, rather than exactly...
My mom always tests surgeons and doctors by speaking Latin to them.
Wow, okay. Half of medicine is Latin.
Exactly. But then like many of them can't reciprocate. So that's when you lost it in my mother's eyes.
Well, I don't know how much I can stand.
My Latin isn't too good, so I'm sure that's fine. But I think it's just like feeling comfortable, obviously, with the practitioner who is treating you. And as you said, like if someone actually gives you kind of like a tailor-made, bespoke approach to how you're going to start, especially if it's your first time.
Absolutely.
Then
that's definitely helpful. Because when you're going first time, you're not quite sure what you want to have. And you might want to kind of discuss it out, because sometimes it's not needed.
Yeah.
And
other treatments
might be better, other than maybe you don't need to have as invasive and you just need more skincare rather than actually having to have a treatment even. And I sometimes turn people down saying that I don't think you need something.
Really?
And which is...
because they already had too much done, or because it's not necessary?
No, usually it's not necessary. And as I said, like, of course, too much is very rarely the situation, because they usually have it worn off by the time they come. But equally, if they're asking for something that makes them look very unnatural, again, I'd say maybe they should look for somebody else.
Yeah, okay.
Something, because you, as clinicians, we want to enhance what you naturally are and make you more beautified, rather than making something out of the norm.
Absolutely. Okay. Anyway, thank you so much for chatting to me. This has been super informative, and I hope my viewers get the answers they wanted.
It was my pleasure. Thanks for coming down to speak to us.
Thank you.